Time now for our weekly checkup with Dr. Isaac Bogoch, infectious diseases specialist. And let's start here, Dr. Bogoch, in Ottawa. Sadly, the tragic news of 3 children dying from the flu. I'm curious if you have any good understanding of why this happened. Do we know their vaccination status, or if there were kind of any extenuating circumstances here?
Yeah, we don't know any of the circumstances around this, but as you point out, it's tragic, and regardless of if there were any underlying circumstances, it's still a tragedy to hear any lives lost from this. What it does reinforce is that we know influenza is a very rough virus. We know it can pack a punch. The technical term is it's virulent. It sadly kills about 400 to 500,000 people per year on the planet. About 2,500 to 3,500 Canadians will succumb to this illness this year. And we know it's most severe in the youngest cohorts and the oldest cohorts, and people who are immunocompromised or have underlying medical conditions. So, the key message here is it's not too late to get a flu shot if people haven't got one already, and we take the flu very seriously.
Yeah, let's follow up there on the flu. Let's sort of stick with that right now, because new numbers came out for Ontario and flu cases definitely up, appear to be a cause for concern this time of year. You were talking about, strain and struggles, or not strains, but like the difficulties in your hospital right now. Range of ages here. Is it the strain of flu this year? Is it a lack of enough people getting vaccinated? Do you expect to see, the province sort of adding any additional guidance here, or maybe putting more of a push behind, reminding people again, hey, you're going to need this to protect yourself?
Yeah, there's a lot of drivers as to why this year is going to be more challenging and more difficult than the average year. But I think the key message here, and of course, predictably, every time, if you look at headlines December for decades ahead, we always see the same story, right? Hallway medicine, difficult times in hospital and healthcare settings. But this year is going to be more difficult than the average year. And we know predictably that older cohorts and younger cohorts are more susceptible to severe influenza. But of course, anyone can get influenza, and most people will feel very, very miserable. We have seen some messaging from senior public health leadership really reinforcing the need to get a flu shot. It's always good to get a flu shot every year, but this year it's especially important to get the flu shot. Briefly, the drivers for a more severe flu season this year is the dominant strain of flu is H3N2, and we know that years that are H3N2 dominant, we see at a population level more severe flu and busier hospitals. But of course, any flu can be severe at an individual level. And the other reason, too, is the vaccine this year, while still providing some protection, doesn't provide the same degree of protection that we would like, but it still provides some protection. That's the take-home point. So if people haven't got the flu shot yet, it's a great time to get one now.
Right. Okay, we've got about a minute left here, Dr. Bogoch, and this is actually going to be our last conversation on Breakfast here for the year. Again, we always appreciate the time you give us each week. But before we say goodbye for the holidays, we'd really like your choice for the top infectious diseases story of 2025. Where are you on this?
Yeah, sadly, I think it's the measles outbreak in not just Ontario, but in Canada. We had over 5,000 cases of measles in the country. This is a vaccine-preventable illness. This is a routine childhood immunization. We should not be seeing outbreaks in Canada, let alone outbreaks of this magnitude. And this was a giant wake-up call that we really need to double down our efforts on funding public health in the country, promoting public health, lowering barriers to vaccinations, but also reaching out to the many communities in Canada to listen and take concerns seriously and address these concerns in an empathetic and fact-based manner so that we can ensure that we have high vaccine rates and prevent outbreaks like this from happening in the future.
Okay, certainly appreciate that. And Dr. Bogoch, it's been about 5 years. I don't think in the last 5 years I've spoken to anybody more on live TV than you. Again, do appreciate the time and the manner you deliver these, conversations in. So thank you so much for this. Have a great holiday season. We'll look forward to talking to you in 2026. Appreciate this.